An article that came out in the Washington Post on August 8th, 2017. Deaths from drug overdoses soared in the first 9 months of 2016. All right, and here's a video. Let's go ahead and watch this video.
New government data shows there were likely 60,000 deaths from drug overdoses in 2016. The latest numbers reveal that overdose deaths reached a record of 19.9 per 100,000 population in the third quarter of 2016. In 2015, there were 16.7 per 100,000 recorded for the same 3 months. Experts tell us that the numbers are rising, not declining. About 6 in 10 drug overdose deaths in the United States are caused by opioids. That would be prescription opioids, fentanyl, or heroin. Heroin was responsible for the largest percentage of overdose deaths in 2015. That percentage has increased dramatically since 2010, from 8% to 25% in 2015. Synthetic opioids like fentanyl have also shown an alarming increase, jumping from 8% to 18%. The President's Commission on Combating Drug Addiction and the Opioid Crisis produced a preliminary report in July that said that drug overdoses kill approximately 142 people every day in the United States. The increase in overdose deaths comes despite determined efforts by government and other public health authorities to intervene in the epidemic. Data from the fourth quarter of 2016 are not yet available, but numbers released by the National Center for Health Statistics show that drug overdose deaths would compute to about 59,520 for 2016. Currently, there are an estimated 2.6 million opioid addicts in the United States. The CDC's last official report said West Virginia, New Hampshire, Kentucky, and Ohio are the 4 states with the highest age-adjusted overdose death rates in 2015. It also said that overdose deaths increased for all age groups in 2015, but adults aged 45 to 54 had the highest death rate. This latest report further supports the information we get from mayors, governors, coroners, and others who have been grappling with the opioid crisis on their streets for years.
Okay, ladies and gentlemen. All right, let's continue to move on. In this article. Okay, deaths from overdoses rose sharply in the first 9 months of 2016, the government reported Tuesday, releasing data that confirmed the widely held belief that opioid plague worsened last year despite step-up efforts by public health authorities. The National Center for Health Statistics reported that drug overdose deaths reached a record 19.9 per 100,000 population in the third quarter, a big increase over the 16.7 reported for the same 3 months in 2015. Similarly, the first 2 quarters of last year showed death rates of 18.9 and 19.3, far greater than the corresponding periods for 2015. Data for the fourth quarter of 2016 are not available yet, so we're still waiting for that. That'll probably be closer to the end of the year. The government's annual drug death statistics typically lag about a year. The latest official information from the Center for Disease Control and Prevention shows the 2015 drug overdose rate at 16.3 per 100,000 people for a total of 52,404 fatal overdoses. Given available state data and anecdotal information, many experts expecting a big increase in deaths in 2016, driven by the worsening crisis in overdoses from opioids, especially fentanyl and heroin. About 6 in 10 drug overdose deaths are caused by opioids. And you can see on the chart how it's rising. Age-adjusted death rates for drug overdose. Okay. As I stated before, this Plague ain't going nowhere. In June, the New York Times predicted that the number of overdose deaths would exceed 60,000 in 2016, based on data it compiled from hundreds of state health departments and county coroners and medical examiners. If true, that number would mark the sharpest annual increase ever recorded. The death rate released by the National Center for Health Statistics for the 12-month ending last September would equate to 59,520 deaths. That is nearly the number of people it would take to fill Chicago's Soldier Stadium, where the NFL Bears play football. The drug overdose numbers are part of a report that looked at mortality rates from leading causes of death. The data shows that the overall U.S. death rate fell slightly in 2016, with top killers such as heart disease and cancer remaining stable. The estimates in the report are adjusted for age and considered provisional, so they may change slightly as states continue investigating the causes of a small number of cases. In a separate study released Monday, a University of Virginia professor of public policy and economics suggests that opioid deaths for 2014 may be much as 24% greater than previously reported. So they're not reporting any of these numbers right, ladies and gentlemen. You know, they have all the reason to hide this stuff because of who it's impacting the most. So it makes sense. So they shouldn't be groveling over these numbers. Either you're going to report the numbers accurately or you're not. And we can see they're just not, which tells me things are way higher than what we're hearing. It's becoming very apparent. The latest government numbers back up the dire accounts of mayors, governors, first responders, and coroners who are grappling with the unabated crisis of overdose and addiction in communities across America. The report is showing the trend that we're seeing around the country from various data sources, said Farinda Ahmed, who wrote the federal report. The data doesn't show any declines at this point. So everything is still rising, no declines. The increases come despite more determined effort by government and private authorities to intervene in the plague, which claims an average of 142 deaths daily. Last month, the President's Commission on Combating Drug Addiction and the Opioid Crisis urged the White House to declare a national emergency, which they are not going to do, by the way. They made the request, but it's not going to be declared a national emergency. The CDC, Food and Drug Administration, and Congress have all taken steps to address the crisis, as have physician groups and private insurance companies. Many communities have made the overdose antidote, naloxone, widely available, and others are trying to provide more treatment for the estimate 2.6 million opioid addicts in the US. But little appears to be working. At this point, death rates for people between the ages of 25 and 44 have risen for virtually every racial group and ethnic group, and in almost all states, according to Washington Post analysis. That might be true, but no one is doing these drugs more than the white community at this point in time. They outnumber everybody, and you can find that anywhere online. Tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. And if you can donate to my channel, please do. Peace, family.